Welcome to Nurse Pro. This is a channel to help you all to pass your OSCE successfully, to get your nursing license so that you can work in the UK. Alright, so today our topic is administration of inhaling medication. This is one of the procedure skills stations. So this channel is just for sharing purpose. I hope that what I introduced to you can help you to pass your OSCE exam more easily and to remember all the things more easily, because you got a lot of things that you need to memorize. So having a good framework then could help you to remember all the points and to carry out your procedure more efficiently and more smoothly. Alright, highly recommended that you could use your own works, and also you could arrange your own sequence to do the task. And if you don't violate the critical points or critical steps, then it is really welcome for you to arrange your own sequence. You can find sequence or wordings that help you to remember best. Okay, and then also remember to check the latest marking scheme, because the NMC will update the marking scheme every 2 months. So there may be new points added to each stations, so therefore you need to read the latest marking scheme so that you will not miss the newly added point. Previously, there is a video. Please refer to the video for the OSCE Framework. It's a very important video that after you understand the whole framework, then you could do you can complete the exam more easily. So for the first few parts, for the general steps, I will go through it more quickly, because these videos I would like to focus on the AIM, the administration of inhaling medication. So first of all, when you know that you need to do the AIM, so the clock is started to run, so it's counting down now. So the first step, before approaching patients, remember you need to ensure the environment is safe, is clean, is clutter-free. The floor, no obstacles on the floor. And then you need to maintain privacy and dignity by closing the door or closing the curtain. Then you need to do a thorough hand hygiene, 7 steps according to WHO guidelines. And after that, you approach the patient. You need to say hi to the patient. You need to say who you are. And I'm the nurse taking care of you today. I'm the nurse looking after you today. Something like this. And then you need to ask the patients, how would you like to be called? Or how shall I address you? Yeah. After that, you need to quickly state the aim of calming. Otherwise, the patients have no idea why the nurse suddenly come to me. Alright? So just use a short sentence. For example, I'm coming today to do the inhaler medication for you. And then you need to check the identity of patients, because this is a very critical point. If you do all the steps and then you find that you forgot to check the patient's identity, you fail the task. Alright? So do it as early as possible. If you're in the hospital, you need to check the name and dates of birth. Can I have your full name, please? And your dates of birth? And then you need to check the wristbands of the patient. Can I check your wristbands against my medical record? Then you need to read aloud the name, dates of birth, and hospital number. If you are in a community setting, you need to check the name, dates of birth, and the full address. Can I have your full name, please? And your dates of birth? Can I have your full address? Something like this. So after this, you need to do some checking procedures to check the allergy status. And then you need to restate the aim of calming, give more details about the procedure, and then you need to gain consent. And after that, you need to check the comfortness. Is the patient comfortable now? You need to give the patient psychological and physical preparedness. Do you need to go to the toilet? Something like that. And then you need to leave the patients and prepare for the task. You may need to gather equipment. You need to check the prescriptions. And after that, you return to the patient and carry out the procedure. So today's topic is administration of inhaling medication. So first of all, for this station, you have 12 minutes. This is a very important position that you need to fulfill. You must ensure that the patient is sitting upright. So maybe you are given a mannequin. The mannequin Susan is sitting upright already. But if you don't state it out, if you don't assist the patient, then the examiner would not know if you really knows that the patients need to be sitting upright. So therefore, I would recommend all of you to say that for this procedure, you need to sit upright. You are sitting upright now, it is very good. So are you comfortable with your position now? Something like that. Or if the patient is lying on bed, lying flat, then you can help patients. And I would like to assist you to sit upright, because for the inhaling medication, you need to sit upright to do it, alright? Something like that. So you need to ensure the positioning is correct. And then explain the reason of calming, right? So because you are having shortness of breath, it is really common that the patient is having shortness of breath or asthmatic attack, that makes you need to give the inhaling medication to the patient, right? So you could state it because you have shortness of breath, so the doctor prescribed the inhaler medication for you. So I'm here to give you the, let's say, 8 o'clock inhaling medication. So these few sentences, you have already told the patients the reasons of calming, and also you give more details about the procedure. And also at the same time, the patient's point of view, the patients understand the reasons of nurse calming. And also ensure that you need to show to the examiner that you know the reasons of giving every medication. And for check comfort, ensure an upright position is obtained, alright? And then you leave the patients, you need to check the prescription. It is good to check the prescription first. After you've checked the correct prescription, you can take the medication while you're gathering the equipment. So read aloud the whole prescription. 5 rights is important. You need to state the right patient, read aloud the name of it, the right drug, right dose, right date, time and frequency, right route. Actually, you will be given a medical record, right? The medication record. You need to read aloud the whole prescription. Then you could get all these points on the question paper. And also you need to check allergy. This is important for every medication administration. Besides 5 rights, you need to ensure the whole prescriptions is eligible. So you need to check if doctors has already signed on the paper, their PIP number written down or GP number. If yes, read it aloud, alright? And also you will see if the doctor have written down the prescription dates. If yes, read it out, okay? And then you need to state that the prescription is complete, valid, and eligible. Then you need to prepare your equipment. You need to get a tray, alright? And then you need to ensure every equipment that you are using is clean. So sometimes the examiner may tell you that all the equipment has already been cleaned before your stations. Then this is very good because you can ensure that the equipment is clean. But if nothing is mentioned, then you need to tell the examiner that, can I assume that the tray is clean? Can I assume that the tray has been cleaned with alcohol wipes? Something like that. So after you ensure that the tray is clean, you use it, okay? So beforehand, you have already checked the medication prescription. So now you check the drug name. Remember, for all the medication, you need to check the package. The package is dry, intact, and undamaged. The expiry date is blah 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 blah, in date or not yet expired. If it got the batch number, please read aloud as well, okay? So for these skills, you also need to get the spacer. Alright, so you are going to return to your patients because you have already gathered all your equipment. At this moment, remember to do the hand hygiene. Remember, every time you approach patients, you leave patients, you do the hand hygiene. Every time you gather equipment and then you finish, and then hand hygiene, alright? So when you're back to the patients, you have left the patients for a while, so please check the identity again because this is a medication, alright? So you need to check the medication, you need to check the identity again. It does not take you much time, you could just use a few seconds to finish this double check. And then you could grab the opportunity to explain the effects and side effects of the medication. There are some common inhaler that will be given to patients. There are some butamol, iprapropium bromide, the atropines, and then the beclomethasone, the steroid, alright? So you need to check the effects and side effects before your exam. and then you tell the patient at this moment. And then you also need to gain consent to proceed. You need to ensure that the patient is happy for you to proceed. And then you need to explain the whole procedure. This is very important because you need to explain the procedure to the patient to ensure that the patients understand how to perform the inhaling medication. So first, for this explain procedure part, you need to remember it all. You need to remember, and then you need to, just like a script, you need to read it out during your exam. First, you need to remove the mouthpiece cover from the inhaler. Then you need to shake it for 2 to 5 seconds to ensure the medication is mixed well. And then you put it into the end of the spacer. You hold the spacer horizontally. So you have already prepared all the equipment, the medication, and then you need to prepare the patient, number 5. Then you need to breathe out completely until your lungs are empty and until you're ready to breathe in, alright? And then number 6, seal your lips tightly around the mouthpiece. Ensure you get a good seal without any air leak. And number 7, then you need to tilt your head slightly backward. So this is to open the airway. And then number 8, you press down firmly on the inhaler canister once. And then you inhale slowly and deeply. For the inhalation, you got 2 techniques. You are now explaining the procedure. That's why you need to explain both techniques to the patient. Let the patient to choose which technique that he would like to use. Number 1, single breath technique. You need to breathe in slowly for 2 to 3 seconds, and then you hold the breath for 10 seconds. And then you remove the spacer from mouth, and then you breathe out gently with a pursed lip. So, is it everyone can do this single breath technique? It depends on if the patient can hold the breath for 10 seconds. Could be a relatively long time if the patient is having shortness of breath. So actually you could observe the patient's maybe coughing or maybe the severity of his shortness of breath, or you can ask the patient to choose which one he would prefer. Okay, for the number 2 one is the tidal breathing, or we call it multi-breath technique. It is easier because you just need to breathe in and out steadily for 5 times. Alright, so you need to introduce both techniques to the patients and let the patients choose. And then this number 10 is rest period. What do I mean by rest period? Like if you're giving more than 1 dose, then you need to wait for 30 to 60 seconds before the second dose, alright? And then before the second dose, make sure to shake the inhaler again to ensure the medication is mixed well. And then you repeat the whole procedure again, alright? But if you are giving another inhaler medication, then you need to wait for 2 to 3 minutes. So because you are having an examination, so running out of time, you need to do at least 30 seconds, okay? So after that, you have explained a lot of things to the patients, so it is very important that you need to check patient's understanding. Is the patient following? So you need to ask the patients, alright? Then you need to repeat the whole script again, but at the same time, the patient do the procedure together with you, alright? So after you finish the whole procedure, then remember to do the documentation. So you need to be quick because 12 minutes is actually very short. You will be running out of time if you spend too much time on the previous steps. You need to do all the steps without missing a single step, but you need to be quick as well, alright? And documentation is very important. If you forgot or if you have no time to sign the medical record, then you fail the task, alright? So complete the medication record. You need to sign your initial, and if there are space that asks you to write the date and time, please make sure you write it. And then for this one, details of person administering medication. If you find a column or if you find a table that asks you to write down the administrator name, please write it down. But if no, it's just a single table, then it will be fine. Just need to sign and with the date and time. Okay. So after the procedure, you need to reassure the patient. You need to ask if the patient is alright. Are you feeling better now? normally he should be feeling better, because after the bronchodilator, he should be feeling breathing more easily, right? And then you need to end it well, end it nicely. Before you leave the patients, if you are in the hospital, give a call bell to the patients. Here I leave you a call bell. Please press the call bell if you need any help, or if you feel any discomfort or shortness of breath. Alright? And then if you're in the community, then you need to ask the patients, please contact your GP if you have any discomfort. And go to the emergency department if it's emergency. Alright? And then before you end, waste disposal. You need to discuss the waste if you have any, and then also you need to clean the equipment. For example, your tray and the spacer. So you need to state that I will clean the tray and the spacer with alcohol wipes and make it ready for next use. And then remember, before you end the task, do the hand hygiene. Alright? So yes, I want to repeat the code for you. During the steps, you are actually demonstrating your professional behavior. So the code is the main thing that you need to fulfill. You have to prioritize people, practice effectively, preserve safety, promote professionalism and trust. So this is the end of this AIM sharing. So you need to remember all the steps of doing the procedure. Especially the sitting positioning. You need to keep the patients sitting upright, and also you need to explain the procedure to the patients clearly. Don't say it too softly, then the patients can't hear you, don't understand how to do it. So you need to be confident and tell the patient how to carry out the procedure, how to perform the AIM, and then you need to check the understanding of the patients. Alright? And also you need to introduce the single breath technique as well as the tidal breathing technique to the patients. And also you need to know that, and you need to state that if you are having more than one dose, you need to rest for 30 to 60 seconds before the second dose. And if you are having another inhaler, you need to wait for 2 to 3 minutes in between. And remember, you need to shake the inhaler well. Okay, shake it for 2 to 5 seconds to mix the medication well. Alright, I hope this video is useful. I hope you understand how to perform the AIM procedure, and wish you good luck in your OSCE exam. Please like and subscribe to the channel, and also watch other videos to prepare for other skill stations. See you in the next video. Bye!